photo here, the same photograph. But this patient living in a village called Awadi is one of a village around 5,000, or group of villages around 5,000 people. 800 of those were blind or severely visually disabled. Now, if you look at that proportion of people, you see the impact that this disease has just because they live close to this river. I also worked in the Central African Republic. These are just all people that live in one village. They're all looking at the camera, yes? They can't see the camera. None of those people can see the camera. They're all sitting there blind. The only reason they're looking to the camera is because I'm talking to them and saying, smile please, I'm taking a photograph. 50% of adults in some villages in the Central African Republic are blind. These are the communities that we are trying to serve with what we're doing. And it's not just an eye disease, it's a skin disease. Legs like this only happen when people have been scratching for months and years. And I tell you, the scratching is much more important to many of these people than problems in the eyes. I could tell you that from experience. When I got it and started taking Mectizan, it was wonderful. But this skin disease, just constant scratching, night and sometimes day and often night, means that actually your whole productivity goes down. Because if you're scratching all night, how do you do a good day's work in the morning? But we have a solution with Mectizan. And initially we started treating individual patients, but then we realized that whole communities need this treatment. We had to develop systems for treating whole communities. One of the things we did in Africa was to develop a system which was called community-directed treatment with ivermectin. Ivermectin is the generic name for Mectizan. So community-directed treatment. These are all community volunteers who are going into the community or live in the community. They're chosen by the community, and you see we have a very good way of measuring the dose. These are dose poles. So they've got their box of Mectizan, they've got their dose poles, and they're going to work in the village to distribute the drug in mass. So everyone in the village will get the treatment unless they're under 5 or if it's women are pregnant, and it's really a village activity. And you know, here you can see we cannot treat children under 5, but we do that by measurement. It's well noted, you see here, there's a guy writing all the details down. So we actually have quite good records at village level of how the treatment is going. Now, you probably here you think, well, we have to have doctors to do this. Well, that's not possible when you're treating millions and millions of people every year. And it's done as a partnership. Here in Burundi, a different country in Africa, we were doing some distribution, and these are all the partners the different partners that were working together to get Mectizan to the people who needed it. So not just as we've got a medicine that can start treating individuals, but we have partnerships that have developed health systems which have had much more impact, and we'll look at that in a minute, much more impact on health than you could otherwise imagine. Now, this is I'm sure represents the way salaries increase in Merck, MSD, sorry, but this is the approved treatments just for onchocerciasis. Now it looks a little bit irregular here. This is because these were treatments that are approved just at the end of the year, but were actually distributed the following year. So what you see is a continuing increase. When this program started, one of the criticisms was, it's a short-term program, unsustainable, it will finish. This is an unsustainable program. More than 25 years, now 28 years, and we're still increasing. The impact of this was pretty well summed up by this guy called Michel.